We'll quickly try to look at computerized tomography, a CT scan, okay? And it's just a modality that we use in the radiology department to basically get images of the inside of the body. So somebody has issues, an internal issue, and there's no point, tearing this person open before you see what is wrong, okay? You can just do a CT scan. So CT scan is also known as, computerized tomography, but it's called, okay, computed tomography mainly as of now. So it's a medical imaging technique and it uses X-rays and computer processing. It will take a lot of pictures. Those pictures are just plain pictures, but it's the computer that will now what assemble these pictures and give you an image that is rounded. To give you a detailed, so it will give you a better picture than the normal X-ray we have. So principle, a lot of X-rays, they rotate around the body. So a computer will now what reconstruct all those pictures into slices. Output, you have good images of the bones, of the organs, of the blood vessels, and soft tissues. Okay, sorry, I explained a lot of things without, recording. So procedure, the patient has to actually what um, lie down. Sometimes, depending on the part of the body that you want to image, you can use contrast dye. You understand? So the patient is lying on the table that slides into a doughnut-shaped scanner. So it takes about 10 to 30 minutes, depending on the area which is scanned. Then radiation energy is used, which is more than the standard X-ray. So that's one of the disadvantages. But the person handling the scan should always, make it that the patient should be, how will I put it? The patient should not be exposed to too much radiation, right? There's sometimes contrast dye is used. Sometimes some patients are allergic to the contrast dye. Sometimes uh, the contrast dye has to be excreted through, the kidneys. So as it's excreted through the kidney, it causes a lot of harm to the kidney. So I think this is what we have for CT scan.